Diagnosis by visceral organs. We continue discussing the heart illnesses. Insufficiency of heart blood. If heart blood becomes insufficient, the heart loses its nourishment. Several mechanisms lead to insufficiency of heart blood. Chronic illness consumes heart blood insidiously. Insufficiency of the spleen and stomach leads to impaired digestion. These and massive blood loss can all lead to insufficiency of heart blood. Insufficiency of heart blood in turn leads to loss of nourishment for the heart and mind and reduces the filling of the blood vessels. As a result, the mind becomes agitated and the entire body suffers from inadequate nourishment. The typical syndrome of insufficiency of heart blood includes the following: palpitation of the heart or neurasthenia, insomnia with much dreaming, forgetfulness, a pale and lusterless or sallow complexion, pale lips and tongue, and a thread-like and feeble pulse. Deficiency of Heart Yin. Syndrome of Heart Yin Deficiency appears when Heart Yin is too deficient to nourish the heart and when fire arises out of Yin deficiency. Heart Yin deficiency frequently results from frustration of the passion so that Qi and fire become trapped in the interior, or chronic or heat illnesses enduring Yin. In Heart Yin deficiency, the heart loses its nourishment and Yin cannot properly restrain Yang. In consequence, endogenous fire arises and causes restlessness and other syndrome of deficiency heat. The typical syndrome of Heart Yin deficiency is as follows. There are palpitation of the heart with restlessness, insomnia with much dreaming, hotness in the palms and soles, flushed cheeks, recurrent fever, and night sweat. Alternately, there are aphthous sores in the mouth and on the tongue. The tongue is red and dry, and the pulse thread-like and rapid. Blazing of heart fire. Heart fire may blaze when the passions are suppressed and transformed into fire, or exogenous heat or fire is strong, or excessive dietary spices transform into heat and generate fire. Whatever its cause, the heart fire blazes and disturbs the mind and damages the blood channels, producing symptoms of heat in the mind, the tongue, and the meridians. The typical syndrome of blazing heart fire is as follows. There are restlessness with insomnia, aphthous sores in the mouth, flushed face, thirst, difficult and painful urination with yellow urine, and dry constipation. In severe cases, there may be hematemesis, epistaxis, or agitation with delirium. The tongue is red with yellow coating, and the pulse is rapid. Thank you for your attention.